In the earlier days, there was pretty much a predictable progression. It would vary by individual in terms of lengths of time from each stage, but there was a fairly predictable progression. And at that point, that was when really the only opportunity we had was to manage the opportunistic infections.
Those 5 years were the scariest years of my life because I was ignorant about the pneumocystis pneumonia. I found out later on that you can catch pneumonia at any time. And the times that I was in hospice, I had the pneumocystis pneumonia.
With what's going on with the medical treatments, that's really changed dramatically. But now with benefits that we have from treatment, which again aren't a cure, but benefits around treatment, an individual can go back and forth from being symptomatic with HIV disease to being asymptomatic.
And I would get better. I mean, it wasn't like it was every day. It was pretty close to every day, but I would get better and think, okay, I got this beaten. But I started getting the flu-like symptoms and the night sweats and started losing some weight, which I was happy about losing the weight. I was always a big guy. And, but it was coming off pretty quick.
AIDS is a defining factor for an individual, and once an individual receives an AIDS diagnosis, they have that diagnosis for the rest of their life. Even if after the point of an AIDS diagnosis, through appropriate HIV treatment and success with that treatment, an individual is able to perhaps have undetectable viral load for a period of time.
And it's pretty scary. In the hospital for 8 days. And that's when the doctor told me that I have AIDS.
I was very fortunate. I was diagnosed late, but my medications worked well, and I was able to come back quite far. Many people who were as far off as I was when they were diagnosed weren't able to bounce back. So it's easier and better if you get tested early.